Hi, my name is Dr. Beltre from Beltre Bariatrics, and this talk I named the Bariatric Surgery 101 because basically it's an introduction to bariatric surgery. What is bariatric surgery? Why each of the procedures work the way that they do, and I hope to answer a lot of the questions that you may have that a lot of my own patients bring to me. The first procedure I'm going to start with is the gastric sleeve. All right, the gastric sleeve, by the way, it's the most commonly done weight loss procedure worldwide because it works well. Number one, well, what's the sleeve gastrectomy? The gastric sleeve, first of all, is done laparoscopically, right? All of the procedures I'm talking about today, at least I do them laparoscopically. Most bariatric surgeons in the United States do them laparoscopically, meaning small incisions or with a robot. 5, 6 small incisions. Biggest incision is less than half an inch, which we try to hide in the belly button if we can. The other ones are a diameter of a pencil, 5 millimeters, so very small. So depending how you heal, you hardly see anything. So laparoscopically, the sleeve itself takes about an hour to do. And basically what we are doing with the gastric sleeve is removing the segment of the stomach here called the fundus, right? So your stomach now goes from being like a football to more like a banana-shaped stomach. That part of the stomach that we remove is the part of the stomach that stretches so you can eat more. Remember, I said that the stomach is a storage organ. That part stretches so you can store more food. In addition to that, that part of the stomach makes a hormone called ghrelin that makes you hungry. So therefore, by removing the segment of the stomach, we are both controlling portions and controlling appetite. However, weight loss with the sleeve and the other bariatric procedures is not so much because you're eating less, right? Because this is a restricted procedure. Remember restriction? Being restricted as to how much you can eat. Smaller stomach, holds less food. But you don't just lose weight because you're eating less. There are hormonal changes that take place with the gastric sleeve that help you lose weight fairly quickly. In addition to the decrease in release of ghrelin to control your appetite, removing the segment of the stomach will have your body release certain type of hormones that regulate your metabolism. So it helps you lose weight faster. Average weight loss with the gastric sleeve the first month can be anywhere between 15 to 30 pounds, depending on the younger individual with a higher metabolism. Then after that, you're going to be losing about 8, 10 a month for the next maybe a few months, a year and a half, depending how large an individual is. Average weight loss with these procedures is anywhere between 100 to 150 pounds the first year. Certainly, I have seen patients, my own patients, other surgeons' patients that can lose as much as 150, as much as 200 the first year, even with the gastric sleeve alone. So the sleeve works by what? Restriction plus metabolic effect, right? Some type of metabolic effect, control of release of ghrelin, and of course, other hormonal release, including GLP-1. GLP-1 stands for glucagon-like polypeptide 1. This is a hormone-like protein that increases release of insulin and makes you sensitive to your own insulin. So therefore, type 2 diabetes goes away fairly quickly. So yes, the gastric sleeve can stop type 2 diabetes, early onset type 2 diabetes, I would say. Someone that's been diabetic for a couple of years, 3 years, only taking maybe pills, the sleeve can definitely stop the diabetes fairly quickly. Fairly quickly meaning days or a couple of weeks. The gastric bypass, we don't remove anything like we do in the gastric sleeve. We actually make a small stomach out of your own stomach, therefore bypassing your main stomach, right? And then we reconnect the intestine to the smaller stomach there so that food can continue going down to the intestines. And then, of course, the bypass stomach still makes gastric juices. There's bile coming from the gallbladder and the liver, which needs to mix in with the food. By the way, it's not on this picture, but the pancreas sits right here. The pancreas also makes pancreatic juices that mix in and helps us break down proteins and fats and so on. And therefore, we have to reconnect the intestines here to establish continuity. I talk about GLP-1 release. Well, with the gastric bypass, the GLP-1 release is even stronger, right? Those metabolic hormones that I talked about that are released after bariatric procedures or metabolic procedures, it's even more robust with the gastric bypass because the bypass now is taking advantage of three things. If you think about it, small stomach, yes, ghrelin release, it's control. And now, of course, you have the foregut theory where this part of the intestine here does not see food. That causes a more robust release of metabolic hormones. And therefore, patients that have type 2 diabetes that are now long-standing, right? Not just for a couple of years, maybe 3, 4, 5 years, that might already be on insulin, right? Those patients are very difficult to control with the gastric sleeve. However, those patients, you can control diabetes and a lot of the time just stop it completely with the gastric bypass just by the hormonal and metabolic release that this procedure has. There's another procedure, and it's called the biliopancreatic diversion, or the duodenal switch. The duodenal switch has two parts. It has a sleeve plus a small bowel bypass. So you can think of the duodenal switch as a combination of both the sleeve and the gastric bypass. This is why it is the most potent, the most powerful bariatric procedures or metabolic procedure. Remember the sleeve, right? We do remove the segment of the stomach here. Now you have a banana-shaped stomach. Food from the sleeve goes into the small intestine. Remember, the small intestine has two parts. The jejunum is the upper part, and the ileum is the bottom part, the bottom half. Well, when we do a duodenal switch, the way that we do them right now in the United States called the SIPS, S-I-P-S. SIPS is single anastomosis duodenal switch. That's the one that I do. I do not do the classical duodenal switch. So after I do this sleeve, you disconnect the upper part of the intestine from the sleeve, right? And then reconnect the bottom part. So therefore, you have now a sleeve plus food goes, instead of going into the upper part of the intestine, now goes into the bottom part of the intestines. We are now bringing partly undigested food directly into the second half of the intestines. With the duodenal switch, you're talking about stopping type 2 diabetes that have been long-standing in 98% of patients, right? If the sleeve maybe can stop 70% of type 2 diabetics, maybe the bypass, maybe about 85%, you're talking about 90, 95, 98% of type 2 diabetics can be controlled with the single anastomosis duodenal switch or the SIPS. In addition to that, weight loss tends to be a little bit more profound, less weight regain because your appetite is controlled a little bit longer. So this is by far the most potent bariatric or metabolic procedure there is. So I hope you understand now how these bariatric procedures work. And by the way, I know I refer to them as bariatric procedures, weight loss surgery. The truth is we also call them metabolic procedures because that's what they do. They affect us metabolically. It's not just eating less. It's not just the fact that you have a smaller stomach. There are release of potent hormones that affects your type 2 diabetes, anything else related to obesity, high blood pressure, sleep apnea. All this stuff can be addressed with these procedures because of the metabolic component. They are not only weight loss surgeries, they are metabolic procedures. I hope that this helps in your decision, or at least in your understanding of how bariatric surgeries work. Whether I'm your surgeon, you can have the surgery with me or somebody else, or go outside the United States. It's good to always be well informed. And I hope this information really helps you make a decision.